These days, there is an increasing trend of using omega-3 fatty acids in your diet and eating oily fish because it might have health benefits. Now, especially in 21st century, people are consuming more and more omega-3 supplements for their own health. So what is omega-3 and what is the health benefit of omega-3? Stay tuned till the end of this video because in this video we are going to talk about the biology behind omega-3 and how it is beneficial or what is the side effects. So omega-3 are PUFA. PUFA means polyunsaturated fatty acid. So if we look at their structure, we would understand. And three major omega-3 fatty acids are alpha-linolenic acid, eicosapentaenoic acid and docosahexaenoic acid. Okay, these names are difficult, so people call them ALA, EPA and DHA respectively. And they are generally found from animal sources such as seafood, fish, etc. and also the plant sources like olive oil, many vegetables, etc. All of them have something in common. If you look at their last carbon and start from there, in the third position there would be a double bond, unsaturation. So this is specifically known as omega-3, and in this omega-3 position there is a unsaturation, that is why these are known as omega-3 fatty acids. So let us talk about the health benefit of omega-3 fatty acids. So these are very important for cardiac health. It reduces inflammation, decreases the chances of cancer, it improves the joint pain or inflammation in the joints. It could be beneficial to reduce anxiety and depression like symptoms, especially in case of pregnant mother. It is very good for baby's health. Now, omega-3 fatty acids are effective to reduce plasma triglyceride level. It has been seen that fish oils are rich in omega-3 and they are very important to reduce VLDL synthesis from the liver. Moreover, in cardiac muscle, in other muscle tissues, omega-3 fatty acids push the system to increase fatty acid uptake and oxidize that fatty acid in the skeletal muscles. So all of these are benefits of omega-3 fatty acids. Now let us look at their effect in bit more details at a cellular level. So every cell has cell membrane. Now these cell membrane are composed of phospholipids. So omega-3 fatty acid can have profound effect on these phospholipids and they can be incorporated in a part of these phospholipids. They can change membrane phospholipid composition and thereby membrane rigidity and membrane signaling. Let me give you an example. So let's say these phospholipids are incorporating unsaturated fatty acid chains. So they are not too much flexible and the membrane is less fluid. But when an omega-3 fatty acid is incorporated in the phospholipid, then due to the kink present in their structure, it is making the whole structure more flexible and it would prevent the membrane to become compact. In other words, membrane fluidity is increasing. That is in turn very important for signaling that is happening from the membrane surface. Omega-3 fatty acid incorporation is very crucial. Other than that, omega-3 fatty acids can directly bind to the retinoic acid receptor. Retinoic acid receptor is a very important intracellular receptor that can lead to several gene transcription. So overall, omega-3 fatty acids might have role to play in gene transcription. It turns out that whenever our body is affected by some kind of pathogen, maybe bacteria or viruses, our macrophages or dendritic cells work like the first line of defense. So they try to engulf the pathogen and eliminate them. And macrophage and dendritic cells secrete inflammatory cytokine, which is kind of protection towards the body, such as IL-6 and IL-1. But too much production of these inflammatory cytokines could be damaging. So omega-3 fatty acids, they prevent secretion of inflammatory cytokines from these cell types. Omega-3 fatty acid actually regulates a crucial transcription factor, NF-kappa B, not shown here, but NF-kappa beta inhibition leads to less production of these inflammatory cytokines. Now, Another manifestation of inflammation is actually prostaglandins, which are derived from arachidonic acids. Omega-3 fatty acid can actually inhibit prostaglandin synthesis enzymes and thereby reducing the level of prostaglandins and thereby reducing inflammation. Other than that, these omega-3 fatty acids, they have profound effect on both innate and adaptive immune system. In the innate immune system, it decreases cell migration, cytokine production and antigen presentation. Whereas in the adaptive immune system, it decreases cell migration, proliferation and cytokine production and also reduce the cellular activation. Other than that, like it has an overall effect of immune suppression. Omega-3 fatty acids like EPA and DHA, they can regulate crucial transcription factor like PPAR alpha and PPAR gamma. PPAR alpha activation leads to decrease in TAG and VLDL secretion by a specific signaling pathway. Also, fatty acid oxidation is increased, which involves PPAR alpha activation by these EPA and DHA. PPAR gamma on other hand side can improve insulin sensitivity or increase TAG clearance or triacylglycerol clearance. All of these things ensures that cardiac health is improved. So overall consumption of omega-3 fatty acid improves your cardiac health, reduce the chances of coronary artery disease. So it's quite beneficial, right? So keeping in all of these things in mind, we should understand that we should incorporate some